I want to turn now to Tom Mulcair. He's our CTV News political commentator and the leader of the NDP, former leader. Good morning to you, Tom.
Morning.
Boy, the passion on all sides from this issue, from doctors, from nurses, from patients, caregivers, it's immeasurable. The use of private clinics to ease surgery, let's start there. Is that an answer or part of an answer to this current crisis?
It can be part of an answer, but it's a very, very slippery slope. I think that Dr. Kaplan-Murth expressed it well. What we need is a better funded healthcare system. Compare that, let's say, to private schools. Why do people argue that private schools get better results than the public system? Because they get to choose their students, and the public system takes everybody. If you're setting up a system where private clinics are going to get government money, and they say, well, we can do knee surgeries or hip surgeries or cataract surgeries, we can do them cheaper. Look who winds up in the hospital sector, the public sector. Look who winds up in those private clinics. It's not the same. They're picking and choosing. It's not true that a homeless person or somebody with a serious mental disorder is going to wind up in one of those public clinics. Those private clinics. They'll wind up in the public sector. So that's the tricky part here. We're looking at a system right now that is indeed underfunded. This goes right back to the conversations you and I have had, Marcia, with regard to the underfunding by the federal government, which has pared back its share of the system. At the beginning, it was 50-50. Now it's closer to 70-30. That's part of the problem. But Mr. Trudeau doesn't want to talk about it. And I don't recall Premier Ford at any time during the recent election campaign that I followed quite closely. I don't recall him saying that he was going to do any of the things that Paul Calandra was saying today with regard to the most vulnerable elderly in Ontario, that he was going to move them out of their communities to maybe open up some other beds. I don't recall anybody in the Conservative Party announcing that just a few months ago.
Let's go back a little bit and talk more about where you were just going between the federal and provincial governments. What does it mean for that dynamic, the announcement we heard today?
It's a conversation that's going to have to take place, and it's going to require people of good faith on both sides, because it's not enough for the provinces just to say, well, here's our hat, put more money in it, and then we'll do whatever we want, and you're not allowed to look at results or give us any advice. The feds, at the same time, have to acknowledge the simple reality that they're not carrying their fair share of the bargain anymore. That's obvious. It goes right back to Paul Martin. It was a Liberal government that did most of that cutting. It was brutal, and the provinces were stuck with it for a long time after that. So let's sit down. Let's get the best people we can, people of good faith from across the country, federal, provincial. A lot of municipalities, by the way, have important public health sectors that they're taking care of as well. Sit down. Constitute a proper commission, sit down, get the best advice, and do something rapidly. This is not something that should be shoveled forward. We've got a pretty good idea of what the problems are. Let's sit down between those different levels of government and put the best minds around the table. I would dare say Dr. Kaplan-Murth would be high on my list of people to include in that conversation.
Tom Mulcair, he's CTV's political commentator and the former leader of the NDP. Tom, thank you so much for that. Really appreciate it.
All the best.
You too.
Bye-bye.